Hello everyone and welcome. Today we're diving into a specific type of kidney stony Topiramate stones. These stones are a less common but important consideration in the world of urological health. We'll explore what they are, why they form, and how they're managed. The primary cause of Topiramate stones is, unsurprisingly, the medication Topiramate itself. This drug, often prescribed for epilepsy, migraines, and sometimes even weight management, alters the way your kidneys process certain substances. Specifically, Topiramate inhibits carbonic anhydrase, an enzyme vital for maintaining proper pH balance in the body. This inhibition is what sets the stage for stone formation. Now let's break down the pathophysiology. Topiramate's inhibition of carbonic anhydrase leads to increased excretion of citrate in the urine. Citrate normally binds to calcium in the urine, preventing it from forming crystals. With less citrate available, calcium is more likely to combine with other substances, most commonly phosphate, to create calcium phosphate crystals. Also, topiramate itself can be excreted in the urine. In some cases, the drug can act as a nidus, or a seed, upon which other minerals precipitate, further contributing to stone formation. A more alkaline urine pH, as caused by carbonic anhydrase inhibition, promotes the formation of calcium phosphate stones. Epidemiologically, Topiramate stones are relatively rare compared to other types of kidney stones, such as calcium oxalate stones. The exact incidence is difficult to pinpoint, as not everyone taking Topiramate will develop them. However, it's estimated that individuals on Topiramate have a significantly higher risk of developing kidney stones compared to the general population. Factors like dosage, duration of Topiramate use, individual metabolic differences, and pre-existing conditions can all influence the likelihood of stone formation. The signs and symptoms of Topiramate stones are generally the same as those of other kidney stones. These can include severe, sharp pain in the side and back, often radiating to the lower abdomen and groin. This pain, known as renal colic, comes in waves as the stone moves through the urinary tract. Other symptoms may include blood in the urine as hematuria, nausea, vomiting, frequent urination, painful urination, and, if an infection develops, fever and chills. Diagnosing Topiramate stones usually involves a combination of methods. A thorough medical history, including medication use, is crucial. Urine tests can detect blood crystals and signs of infection. Imaging techniques, such as a CT scan of the abdomen and pelvis, are the gold standard for visualizing the stones, determining their size and location. X-rays, although less sensitive than CT scans, can also be used, particularly if the stones are known to be radiopaque, easily visible on X-ray. Sometimes an ultrasound may be used, particularly in pregnant women or when avoiding radiation is preferred. While we don't classify Topiramate stones as a distinct type beyond the general kidney stone category, it's important to identify their composition, most commonly calcium phosphate. Understanding the composition helps guide treatment and preventive strategies. Treatment for Topiramate stones depends on the size, location, and severity of symptoms. Small stones may pass on their own with plenty of fluids and pain medication. Alpha blockers, medications that relax the muscles in the ureter, can help facilitate stone passage. Larger stones may require intervention. Options include extracorporeal shock wave lithotripsy, ESTOL, which uses shock waves to break the stone into smaller pieces, ureteroscopy, where a small scope is inserted through the urethra to visualize and remove or break up the stone, and percutaneous nephrolithotomy at PCNL, a more invasive procedure used for larger or complex stones. In some cases, discontinuing or reducing the Topiramate dosage, under the guidance of a physician, may be necessary. Preventing Topiramate stones involves several strategies. The most important is adequate hydration, aiming for a high daily fluid intake. Monitoring urine pH and citrate levels can help identify individuals at higher risk. Potassium citrate supplementation can help increase urinary citrate levels. Inhibiting stone formation. Dietary modifications such as reducing sodium intake and limiting animal protein can also be beneficial. Regular follow-up with a healthcare provider is essential to monitor kidney function and stone recurrence. The prognosis for individuals with Topiramate stones is generally good with appropriate treatment and preventive measures. However, stone recurrence is possible, especially if the underlying risk factors are not addressed. Recent research is focusing on developing more targeted therapies to prevent Topiramate-induced kidney stones, including exploring different formulations of Topiramate and identifying genetic predispositions to stone formation. Studies are also investigating the effectiveness of different preventative strategies, such as varying potassium citrate dosages based on individual urine chemistry. Maintaining open communication with your doctor and adhering to their recommendations is key to managing this condition effectively.